Hi, this is Anu and you're watching Anu for Nurses. Today we try to solve a few questions from Cushing syndrome and Addison's disease and let's see the difference. Which is not a feature of Cushing syndrome? Brown skin, hirsutism, buffalo hump, hypernatremia. Try to recall the features of Cushing's, and brown skin is definitely the feature of Addison's disease. Hirsutism, buffalo hump, and hypernatremia are the features of Cushing syndrome. Second question, which is a priority teaching on discharge of a patient with Cushing syndrome after adrenalectomy? Identify the priority of teaching on discharge of a patient with Cushing syndrome after adrenalectomy. Steroid replacement therapy, avoiding oranges and avocado, adequate fluid intake, and features of Cushing's disease. Which one is the priority of teaching here? Definitely it is a steroid replacement therapy because they have to take it lifelong, and also the steroid tablets when they take, they'll have to take at the same time every day. That's the priority of teaching here. Identify the right suggestion of diet for a patient with Addison's disease. High fat and protein, low sodium and high potassium, high protein and adequate salt, low carbohydrate, high protein and increased sodium. Which is the right diet for the patient with Addison's disease? It is the high protein and adequate salt. They'll be at risk for infections, and also vitamins, protein and all should be given adequately, and salt should be adequate in quantity. They will have hyponatremia. Increased salt to be given when they have dehydration or some extra fluid loss or dehydration related, especially during summer and all, they'll have to take extra salt. The nurse would expect to find what feature on assessing a patient with possible Cushing syndrome? Fatty arms and legs, thick dry skin, deposits of adipose tissue on the trunk, and hypotension. Which is the feature? Yes, it is the truncal obesity and thin extremities are the important features. Fatty arms and legs are not their feature. They will have thin arms and extremities with truncal obesity, and more than the thick or dry skin, they will be having the striae, acne, hirsutism, all other skin changes usually expecting in Cushing's, and hypertension is what you will expect in Cushing's, not hypotension. Hypertension is a feature of Addison's. Next question is, in a 35-year-old female patient successfully treated for Cushing's disease, the nurse would expect a decline in glucose level, alopecia, bone mineralization, and menstrual flow. What will, carefully read the question, what would expect a decline in? Which one will reduce? Hyperglycemia is a feature of Cushing's, and definitely a good outcome or a healthy outcome is decline in glucose. Its hirsutism is more a problem in Cushing's, and you should expect to reduce the hirsutism, and it's not the alopecia to be reduced, and it's not the bone mineralization to be reduced. It has to be actually bone mineralization has to happen, and demineralization has to be reduced. And so menstrual flow is not a, it's like amenorrhea problem will be there, so it's not related to the menstrual flow. So the ideal answer is glucose level. These questions are kind of tricky question. You may be knowing the answer, but it might confuse you, so be very careful when you read such questions. Priority care for a patient with Addison's disease. Risk for infection, excess fluid volume, urinary retention, and hypothermia. The priority care is risk for infection. Remember, Addison's disease decreases the production of all adrenal hormones. It means like your cortisol and all are stress hormones. When their levels is decreased, it compromises your body's normal stress response, and it increases the risk of infection, especially lower respiratory tract infection. So risk of infection is the most important priority for a patient with Addison's disease, and it's not the excess fluid volume, it's decreased or deficient fluid volume is the main problem in them. It's not urinary retention, there is no retention and all for them, and it's mainly hyperthermia, especially due to the dehydration and all. Which of the following below is not a feature of Addison's disease? Severe pain in the stomach, legs, and back, hypokalemia, hyponatremia, hypotension. Which is not a feature of Addison's disease? Try to recall the electrolyte imbalances happen in Addison's. Yes, it is hyperkalemia usually happening in Addison's, not hypokalemia. Other features are features of Addison's. Especially severe pain in the stomach, legs, and back experience in Addisonian crisis more than the Addison's disease. But because of the electrolyte imbalance, there can be pain in the legs, back, and all. What's the first line of management in adrenal crisis? Whether it's fluid replacement, IV corticosteroids, esthalin nebulization, or diazepam. It is IV corticosteroids. IV corticosteroids is the first line of management in adrenal crisis. You don't have to think about it 2 times. They require fluid replacement. Even esthalin nebulization will help to an extent to reduce potassium level, but IV corticosteroid is the first priority of management in adrenal crisis. What is the most common cause of Cushing syndrome? Ectopic ACTH production, adrenal adenoma, pituitary adenoma, and glucocorticoid treatment. What's the most common cause of Cushing syndrome? We have already discussed this in the previous video, and definitely it is the glucocorticoid treatment, especially for the arthritis, asthma patients and all. We are using the steroid as an important regimen in their treatment, and this is the reason for Cushing syndrome. What is the most common cause of Cushing's disease? Try to recall Cushing's disease is caused by what and Cushing syndrome is caused by what. So the most common cause of Cushing's disease, whether it's ectopic ACTH production, adrenal adenoma, pituitary adenoma, or glucocorticoid treatment. Pituitary adenoma is the most common cause of Cushing's disease. Next, on discharge, which of the following statements by the patient warrants re-educating the patient? I'll take this medication as needed when symptoms present. I'll notify the doctor if I experience extra stress. I'll take this medication at the same time every day. I'll use a medic alert bracelet. So which statements warrants that you need to re-educate the patient? I'll take this medication as needed when symptoms present. Wrong. They should take the medication every day, lifetime, and at the same time every day. So they will notify the doctor if they experience extra stress, it's right, and they will take the medication at the same time every day, that's right, that's required, and they need to use a medic alert bracelet so that if they become unconscious and when they're experiencing adrenal crisis, others can identify that the patient is having this already Addison's disease or their adrenalectomy they have undergone. So this is very important. Now, which of the following are symptoms of Addison's disease? Select all that apply. Which all are the features of Addison's? Truncal obesity, weight loss, postural hypotension, hypercalcemia, abdominal striae, weight gain, hyperpigmentation, and fatigue. Recall, what are the features of Addison's? Is it truncal obesity? No. Weight loss? Yes. Postural hypotension? Definitely, when there is fluid loss and all, postural hypotension can occur. Hypercalcemia, yes, we have explained that there will be increase in the calcium level. Abdominal striae, no. Weight gain, no. Hyperpigmentation, yes, brown skin is a feature. Fatigue, yes, because of the dehydration, electrolyte imbalance and water loss, there will be fatigue in the patient. So these are the features. Now, Cushing's are more common among, whether it's among women, men, or equal in both gender. Cushing's are more common among women. Which statement by a patient with Cushing's disease on discharge indicates that she understood what's explained to her. I can eat good amount of potassium rich foods. I can eat salty cheese and burger. I need to control protein intake. I don't have to follow any dietary restriction. So, which one is the right explanation by her, or which one indicates that she understood what is explained to her? I can eat good amount of potassium rich foods because hypokalemia is a problem in them and they need to take good amount of potassium. So that is the right teaching. Choose the appropriate response to tell a patient with Cushing syndrome when she is worried about her physical changes. There will be a lot of physical changes in the patient and the patient is worried about it. Which is the right statement you need to give to the patient, or right response to give back to the patient? This is permanent but not important. This will improve slowly after treatment. Try not to worry as you need to concentrate on many other things. This can be covered using proper clothing. So which is the right thing to give? This is more than the disease condition. This is all about the therapeutic communication too. You need to know about the condition and prognosis, but you need to know how to communicate too. So this is all about. This will improve slowly after treatment. The features of Cushing's, most of the features will be reverted back once the condition improves. This is the right education need to be given to the patient. That's all for today. Again, we'll be back with another topic. Till then, keep learning and see you again. Bye.